Actually, we use the medication assistance program on many occasions. Every week we need to utilize it for patients that we see here in the hospital that either can't afford their medications because they don't have insurance, or they can't afford their medications because their co-pays for that medication are too high.
So you can have insurance and we will help you, or if you don't have insurance, then we get them free from the pharmaceutical companies. You know, they know how much their medicine is and they don't have the copay, or they're coming here and then I pay for it. They like cry, which then makes me cry, and then I'm like, let's not do this, because then everybody's crying and no one's picking up medicine. I think it's overwhelming because people don't understand there is a program out there that will help them.
I'm a diabetic, which I've been for 48 years. And my insulin is very expensive, and I take 4 injections a day, and so I tend to go through a fair amount of insulin in a month's time. But without that, I really don't know what we had some really difficult choices we would have had to make, like do you buy food or do you buy your insulin? Of course, I guess if I didn't eat, I wouldn't need as much insulin. We're just grateful for that.
There have been many changes in healthcare. One of them has been positive in that many people now have insurance when they had not in the past. And although that sounds like a good thing, many of these plans still require patients to dig deep into their pockets and make difficult financial decisions when it comes to their health. Do I pay for a prescription medication, or do I heat my house? That's a decision that the medication assistance program has helped many people solve and not have to choose one over the other.
The program itself is so important. There are so many people that would fall through the cracks if they didn't have this available to them. We'd be seeing patients come back because of their illnesses, just basically because they couldn't afford their medications, and we really want to prevent that in every way possible.
The Impact Concussion Testing Program has been around for about 15 years. It's a computer test that tests neurocognitive ability, your thinking ability, and what it really measures is memory, and it measures reaction time. So to have this computer test is just amazing. It gives us information that we could never get any other way. So you can really see how 1 day or 2 days makes a huge difference in an athlete that has a concussion. And it really, the test is able to tell us when they're back to their baseline. It's not perfect, but it really is so much better than anything we had in the past.
I was playing ultimate frisbee, and I went up to catch a disc, and I got sandwiched between 2 guys that were bigger than me, and I got elbowed right in the forehead. My teammates said that I got knocked out, and then I fell, hit my head on the ground again.
In 7th grade, Caden had the baseline testing done, where he went through the impact test so they could get his baseline, basically, to know where he was at then.
I was having a lot of concussion symptoms. They took me into the doctor the next day, and they diagnosed me with a concussion. It really helped me know that I did have a concussion, and they could, really slow me down, back me up.
Impact really is that verification tool that can determine whether or not, I guess if we're sitting the fence line, whether or not a concussion is actually going on. It's a very easy to test. It takes about 30 minutes for an athlete to do, and again, it just alleviates that process for all of us.
I would really just express my gratitude towards them and them supporting them, the whole program, the foundation, because I'm a really athletic guy, and if I didn't have this and I didn't know that I had a concussion, I'd be really sad, because that would have impacted my entire life and really messed my head up.
The funding for St. Michael's Foundation is huge, because we know that less than 40% of high schools in the United States have athletic training coverage. We're part of that. All our schools around here have full-time athletic training coverage because of what ministry has provided. St. Michael's Foundation has provided baseline testing, which is also huge. And without a baseline, you're hedging that day. I'm hedging that day. Do I let them go back or not? So that baseline is so important. It's so huge. And the foundation gives us thousands of dollars a year to do that.
So the SANE program provides victims of sexual assault a fully extensive medical exam. That's our #1 priority. We want to make sure that they're medically stable. If they so choose, they can do the actual forensic exam, which takes about 4 to 5 hours. We're collecting DNA. The SANE program here at St. Michael's, we started it in 2006. It was a huge relief for the department because these nurses could come in and do the procedure, knew what they were doing.
It's very helpful for the victims of sexual assault to come into the emergency department, to have a nurse who's dedicated to spend time with them and get them through their exam and get them set up with follow-up in the community, and just have one person who can be there who's trained in taking care of people going through this. I think it's very important for them to have someone who can be there and walk hand in hand with them through the exam. The exam itself is a traumatic thing for them to have to go through, and I think to have someone there who's dedicated to them and understanding it is important.
So many women out there, they'll blame themselves and think, you know, it was my fault. And I've even known people say, I was raped, but it was my fault. And they say that right after, you know, they said it, and I think it's so important. This program is more important than anything than reporting, is getting help, because there's so many long-term effects that these women suffer from. And so I think with funding, we can help in all those areas.
There's certain training that we nurses need initially, which is getting the initial training of this, and also continuing education that the foundation could support and does support.
The funding of this program is essential for our department, for this community, and for the victims of sexual assault.